हेलो रिया, आपको आवाज आ रही है आप लोगों को?
यस मैम।
स्लाइड शो हो रही है? स्लाइड शो हो रही है?
यस मैम।
ठीक है। Today we are cage. So first of all, the thoracic cage, an introduction related to the thoracic cage. It is a bony cavity that surrounds the mediastinum, and on each side of the mediastinum there are lungs. So the structure of the thoracic wall. The bony thoracic wall is anteriorly bounded by a bone that is known as a sternum, along with the costal cartilages. Laterally by the ribs, and in between the ribs there are intercostal spaces that lies on the lateral aspect of the thoracic cage, and the posterior boundary is formed by the thoracic vertebrae. So overall, the boundaries of the thoracic wall anteriorly bounded by the sternum and costal cartilages, laterally by the ribs and the intercostal spaces, and posteriorly by the thoracic vertebrae, the thoracic part of the vertebral column. So the most anterior bone of the thoracic wall or thoracic cage is the sternum. The sternum is divided into three parts. It's a type of flat bone that lies in the anterior part of the thoracic wall, consists of three parts. The most superior part is known as the manubrium part of the sternum. Then there is a broader part, much larger part known as the body of the sternum, and inferiorly there is a xiphoid process. So there are three parts of the sternum: the manubrium part, the body of the sternum, and xiphoid process. So the first part, the manubrium part of the sternum, articulates with the body of the sternum at a joint known as of the manubrium. There are other two articulations. Is a clavicular notch for the articulation with the clavicle and forming the sternoclavicular joint. Another articulation, there is a facet on the lateral side of the manubrium part of the sternum for the attachment of the costal cartilage of the first rib. So these are the three articulation of the manubrium part of the sternum for the sternoclavicular joint, for the joint with the costal cartilage of the first rib, and the third articulation is between the manubrium and the body of the sternum and forming a joint known as manubrosternal joint. And this elevated part or bridge known as an angle, the sternal angle, also known as angle of Lewis. Another feature of the manubrium part of the sternum, there is a depression on its superior surface that is known as jugular notch, also known as suprasternal notch. So these are the important features related to the manubrium part of the sternum. Then the second part of the sternum, known as the body of the sternum. The body of the sternum contains the facets or costal notches on each side. On lateral sides, there are notches or facets for the articulation of the costal cartilages of the ribs 2nd to 7. So for the attachment of the costal cartilages of 2nd to 7th ribs, there are different facets, or you can say these are the costal notches on the lateral aspects of the body of the sternum. Two other articulation, first with the manubrium part forming the manubrosternal joint, and inferiorly another articulation is in between the body of the sternum and the xiphoid process, and this joint is known as the xiphisternal joint. Then the third part of the sternum, known as the xiphoid process. The xiphoid process is a smaller process, lies at an inferior part of the sternum. This part, xiphoid process, is first cartilaginous in neonatal life, then In adult life, it becomes ossified. So these are the different parts and features of the sternum. Three parts: manubrium, body of the sternum, and xiphoid process. Two main articulations are joints formed by the manubrium and the body of the sternum, the manubriosternal joint, and other between the body of the sternum and xiphoid process known as the xiphisternal joint. Other articulations are for the clavicle, forming the sternoclavicular joint with the costal cartilage of the first rib. And on the body of the sternum, there are different facets for the second to seventh costal cartilages. Another important feature of the sternum is the sternal angle, also known as the angle of Lewis. That is an articulation between the manubrium part of the sternum and the body of the sternum and forms a transverse protrusion or prominence or a transverse ridge that lies at the level of the second costal cartilage, and that is the point from which you can count all the costal cartilages and ribs. So that is an important landmark, anatomical landmark for counting of the ribs. So that's why that is an clinical significance of the sternal angle or the angle of Lewis. That is basically a joint between the manubrium and the body of the sternum. This point is important. One of the important feature for this angle of Lewis is you can count the ribs from there, because at this level, there is an attachment of the second costal cartilage at this level. So first of all, you have to palpate this sternal angle, then locate the second rib, and after that, the corresponding intercostal spaces and the ribs you can easily count. The sternal angle lies opposite on the posterior aspect. The landmark goes towards the intervertebral disc that lies between the fourth and the fifth thoracic vertebrae. Then the second structure of the thoracic cage are the ribs. There are 12 pairs of the ribs and they are attached posteriorly to the thoracic vertebrae. The classification of the ribs, there are three main types of the ribs according to the attachment of the ribs to the sternum. They are divided into true ribs, false ribs, and floating ribs. The true ribs, that are the ribs that throw their costal cartilages directly attached to the sternum, so they are known as true ribs. The false ribs are indirectly attached to the sternum by the formation of the costal margin that is attached to the costal cartilage of the seventh rib, and then that attached to the sternum. The floating ribs floats in the abdominal cavity and having no attachment with the sternum. So that is the different types of the ribs, the main true ribs, then the false ribs and floating ribs. The true ribs from 1 to 7, they are known as true ribs because they directly attach to the sternum through their respective costal cartilages. 8, 9, and 10, they are known as false ribs because they indirectly attach to the sternum by formation of this costal margin that is attached to the seventh costal cartilage. Then the floating ribs, having no attachment with the sternum, they floats in the abdomen. Now, on the basis of the features of the ribs, they are divided into typical and atypical ribs. A typical rib having common features, and if some ribs having different features from that of the typical rib, so they are known as the atypical rib. So first of all, we should know about the typical features of the typical rib. A typical rib is defined as, first of all, the type of the bone. It is a type of the flayed bone having two superior border and an inferior border. The superior border is somewhat smooth border, but its inferior border is much sharper border. And on this inferior border, there is a groove or depression known as costal groove, in which there is an neurovascular bundle of the composed of intercostal artery, intercostal vein, and intercostal nerve runs in this costal groove. The main parts of a typical rib are, it consists of a head, a neck, tubercle, shaft, and the angle of the rib. So each typical rib consists of the following parts: a head of the rib, the neck, the tubercle, shaft, and the angle of the rib. On the head of each rib, of each typical rib, there are two facets for the articulation with the numerically corresponding vertebral body and the vertebral body that lies above it. So there are two facets of each rib on its head. See in this figure. This part is known as the head of the rib, and there are two facets, one for the corresponding vertebrae and the second facet for the vertebrae that lies above it. Then the second part of the vertebrae is known as the neck of the vertebrae, that is a constricted part lies between the head and the tubercle. This constricted part known as neck of the typical rib that lies between the head and the tubercle. The third structure, the third part of a typical rib known as the tubercle, that is a prominence present on the outer surface of each rib. This tubercle contains a articular facet for the attachment of the vertebrae that is present on the transverse process of the vertebrae. So for each rib, there are three articular structures or articular facets for the articulation of vertebrae. Two facets present on the head, and the third facet for the attachment with the transverse process of the vertebrae. Then there is a shaft of the rib. It's a thin and flattened and twisted on its long axis. The part is known as the shaft of the, this is the shaft of the rib. The angle is the part where the shaft of the rib bends forward. The point of bending of a rib known as the angle of the ribs, where it bends sharply. This part is known as the angle of the rib. So each typical rib consists of a head, a neck, a tubercle, shaft, and angle. The superior border is smoother, and inferior border contains a groove or depression known as the costal groove, which contains the neurovascular bundle. Typical ribs are from third to ninth. Third to 9 pairs of the ribs are known as the typical ribs. It means the first, second, 10th, 11th, and 12th ribs, they are the atypical ribs. We have discussed the features of the typical ribs. If there is a difference in the features, then the ribs are known as atypical. The first rib, second rib, and 10th to 12th. 10th, 11, and 12 ribs, they are known as the atypical ribs because they have the different features from the typical ribs. So first of all, the features of the first rib, why they are, this one is known as atypical rib. The first rib is much broader and shortest as compared to the typical ribs. And the second feature, it has a single facet on its head for the articulation with T1 vertebrae. So first feature, it is much broader and shorter as compared to the other typical ribs. Second feature, all the typical ribs contains two facets on their heads, but the first rib contains only a single facet for the articulation with T1 vertebrae. And there are two grooves on its superior surface for the subclavian artery and subclavian vein, and these grooves are separated by a tubercle or protrusion known as scalenus tubercle for the attachment of the anterior scalenus muscle. So three other features. First of all, this one is more broader and shorter. Second, there is only one facet on the head of the rib. Third feature, there are on the superior surface, there are grooves and ridge. two groups for the passage of the subclavian artery and subclavian vein, and these two groups are separated by a type of protrusion known as scalene tubercle, on which the anterior scalenus muscle is attached. Now the features, different features of the second rib, why it is known as atypical rib, because it is much thinner and has a less curved shaft as compared to the typical ribs. It contains two facets for the articulation, so there is no any difference between the head or the facets of the second rib and the facets of the typical rib. So only the feature, the first feature, why it is different, it is thinner and shaft as a less curve as compared to the typical ribs. Its main atypical feature is a tuberosity for the serratus anterior muscle, from which the serratus anterior muscle originates. So two important features why it is atypical, it is thinner and as a less curve as compared to the other typical ribs. Another feature and feature that separates it from the typical ribs is in presence of a tuberosity for the serratus anterior muscle. Then the other atypical ribs from 10 to 12 ribs, they have only one facets on their heads for the articulation with the vertebrae. So they articulate only with the single vertebrae. 11th and 12 ribs are shorter and have no neck or tubercle. So that is an different features from the typical ribs. Now the thoracic vertebrae, the features of the thoracic vertebrae, these are the different features on which we differentiate the cervical vertebrae, thoracic, lumbar, sacral, and the other vertebrae. So the vertebral body of the thoracic vertebrae is heart shape and having slightly heart shape, is resemble to the heart structure. So that is the body of the thoracic vertebrae, that is somewhat heart shape. And there are one or two costal facets for the articulation with the head of the rib. On each side, these are the costal facets for the articulation with the head of the ribs. The vertebral foramen of the thoracic vertebrae is circular and smaller. This is the vertebral foramen that is circular and smaller as compared to the other vertebrae. The transverse process of the thoracic vertebrae is longer and extend posterior-laterally. The other articular processes are on the superior facets directed posterior-laterally. These are the superior facets, articular facets that lies posterior-laterally, but the inferior facet directed anterior-medially. And the spinous process is long and slow posterior inferiorly. So these are the main parts, the body of the vertebrae, thoracic vertebrae. Then this one is a circular vertebral foramen. This one is the spinous process that is longer. On the transverse process, these are the two transverse processes, articulation with the of the rib. And there are two other type of the facets processes, the superior articular facets, and on the inferior aspect, there are inferior articular facets. Like the ribs, the thoracic vertebrae are also divided into typical and atypical thoracic vertebrae. From second to 9, they are, these are the features of a typical thoracic vertebrae. But some of the features are different from 2 to 9 thoracic vertebrae. So the first thoracic vertebrae, 10th, 11th, and 12th, they are known as atypical thoracic vertebrae. In the first thoracic vertebrae, it has a smaller body and long horizontal spine and the upper complete facet. On the lateral aspect, there is only one facet for the articulation with the first rib. In the 11th and 12th and the 10th thoracic vertebrae, there are complete facets on the only laterally as compared to the inferior facets of the typical vertebrae that lies medially. And there is a short blunt spine as compared to the long spine of the typical thoracic vertebrae. So these are the different features. So these vertebrae are known as atypical vertebrae. So these are the three types of the bones related to the thoracic cage. In the anterior part is sternum, posteriorly the thoracic vertebrae, and laterally the ribs. Now these are the two apertures of the thoracic cage. The superior thoracic aperture on the superior aspect, also known as thoracic inlet, and inferiorly, this one is the inferior thoracic aperture, also known as thoracic outlet. The superior thoracic aperture is bounded anteriorly by the manubrium part of the sternum, on the lateral aspect by the first rib and its costal cartilage, and posteriorly by the body of the T1 thoracic 1 vertebrae. These are the boundaries of the superior thoracic aperture. Anteriorly by the manubrium part of the sternum, on the lateral aspect by the first rib and its costal cartilage, and posteriorly by the T1 vertebrae. The inferior thoracic aperture is bounded anteriorly by the xiphi-sternal joint and xiphoid process, anterolaterally by the costal margin, posteriorlaterally by 11th and 12th ribs, and posteriorly by the 12th thoracic vertebrae. So these are the boundaries of thoracic outlet are inferior thoracic aperture. This aperture is closed by the diaphragm, which contains numerous openings for the structures to pass from the thoracic to the abdominal cavity or from the abdomen to the thoracic cavity, respectively. Now the joints of the thoracic wall. These are the different joints of the thoracic cage or thoracic wall. The intervertebral joint, the costovertebral, costochondral, interchondral, sternocostal, sternoclavicle, manibro-sternal and xiphi-sternal joints, जो कि हम पहले भी डिस्कस कर चुके थे. Then again with the thoracic cage we have to discuss these joints. The intervertebral joints, as its name indicates, the joint present in between the adjacent vertebral bodies, and they are bound together by the intervertebral disc. So the joint between the bodies of the adjacent vertebrae that are connected by the intervertebral disc. These are the type of the intervertebral joints. The type of the joints, they are the secondary cartilaginous joints, and the associated ligaments of the intervertebral joints. On the anterior aspect, there is anterior longitudinal ligament, and posteriorly, there is an posterior longitudinal ligament. So anteriorly, the joints are strengthened by the anterior longitudinal ligament, and on the posterior aspect, there is an posterior longitudinal ligament. The second type of the joints are known as costovertebral joints, the costovertebral and the rib. The joints between the vertebrae and ribs, collectively known as costovertebral joint, that consist of joint, and their variety are plain joints. So again, these are the parts of the rib. On the head of the rib, these are with the tubercle of the rib that is present on the transverse process, and these are the two demifacets of each vertebrae. So first type of the joints are known as joints of the head of the ribs. The articulation is between the head of each rib articulate with the superior facet of the vertebrae that of same number. For example, this is the seventh rib. So the seventh rib articulate with the superior facet of the vertebrae of a corresponding number. Seventh rib articulate with the superior facet of T7 vertebrae. It articulates with the inferior facet of the vertebrae that lies above it. Okay, so there are two facets on each rib head. First facet articulate with the superior facet of the corresponding vertebrae, and another facet articulate with the facet, demi-facet of the vertebrae that lies above it. It means के T6. But there are some exceptions. जिस तरह हमने typical, atypical ribs or atypical vertebrae discuss किए हैं. So that's why the heads of the first rib, 10th rib, 11th and 12th rib, they articulate only with the vertebral bodies of the same number. There is no any articulation with the vertebral body that lies above it. The ligaments associated with the joints of the head of ribs, there are two types of the ligaments, the radiate ligament and intra-articular ligaments. जी प्रांजल जी बोले।
मिस जैसे आपने कहा कि जो 10th रिब है उसका वो अपने कॉरेस्पॉन्डिंग वर्टिब्री नंबर के साथ ही अटैच होगी, तो फिर 9th वर्टिब्री के इंफीरियर बॉर्डर पे क्या अटैच होगा?
9th रिब के या 9th वर्टिब्री के?
9th वर्टिब्री के
नहीं अटैचमेंट है ना उसकी, नहीं है
तो फिर उसको एटिपिकल कंसीडर क्यों नहीं करता?
रिब को या वर्टिब्री
को?
वर्टिब्री पे तो दो फैसेट्स हैं ना,
तो लेकिन उसके इंफीरियर बॉर्डर पे तो अटैचमेंट नहीं हो रही ना।
हाँ उसके इंफीरियर बॉर्डर पे अटैचमेंट नहीं हो रही क्योंकि 10th रिब का जो है वो एक ही फैसेट है।
तो फिर हम 9th वर्टिब्री को एटिपिकल कंसीडर करें ना।
9th वर्टिब्री को हम एटिपिकल कंसीडर कर सकते हैं लेकिन नहीं करते हैं। So two types of the ligaments are attached with the head of the articulations with the head of the rib with the vertebrae. These are the radiate type of the ligament, and the second type of the ligaments are the intra-articular ligaments. The second type of the joints are known as costotransverse joints. The costotransverse joint is a joint between the tubercle of the rib that articulate with the transverse process of the vertebrae of the same number. So the articulation between the tubercle of the rib, here is a tubercle of the rib that articulates with the tubercle or facet that is present on the transverse process of the vertebrae of the same number. Except the 11th and 12th ribs, they don't have any articulate with the transverse process of the vertebrae. The ligaments that are associated with the costotransverse joints, these are the lateral and superior costotransverse ligaments. So this ligament is the lateral costotransverse ligament, and this is the superior costotransverse ligament. Another type of the joints are costochondral joint. The articulation between the lateral end of the costal cartilage with the external end of each rib. These are the type of primary cartilaginous joint, and the cartilage and the bone, they are bound together by the periosteum. The costochondral joints are the joints between the external end of the rib with the costal cartilage, and these are the type of the primary cartilaginous joints. These are the costochondral joints, the joints between the external end of the rib with the costal cartilage. The interchondral joints are the joints between the costal cartilages of 6 and 7, 7 and 8, 8 and 9 ribs, and they are forming the costal margin. These are the type of the synovial plane joints. These are the articulation between the costal cartilages of 9th and 10th rib. It is a type of the fibrous joint. All the other are plain synovial joint. The ligaments that are associated with the interchondral joints, they are known as interchondral ligaments. So these are the interchondral ligaments connecting these interchondral joints. The sternocostal joints. Now there is a difference. The first joint, first sternocostal joint is a type of primary cartilaginous joint, and from 2nd to 7th, they are of the synovial plane joints. The articulation of the first costal cartilage is with the manubrum part of the sternum, but from 2nd to 7th pair of the costal cartilages, they are attached to the body of the sternum. The associated ligaments are anterior and posterior radiate and sternocostal ligaments. The sternoclavicular joint is a type of the saddle type of the synovial joint. It is an articulation between the sternal end of the clavicle with the manubrum part of the sternum. Along with it is also attached to first costal cartilage. So the sternoclavicular, this is an anterior sternoclavicular ligament, and posteriorly there is an posterior sternoclavicular ligament. The second type of the ligament are costoclavicular ligaments. The costoclavicular ligaments are this one is the costoclavicular ligament, the ligament between the clavicle and the costal cartilage of first rib. The manubro-sternal joint, the joint between the manubrum part of the sternum and body of the sternum, known as manubro-sternal joint. It is a type of the secondary cartilaginous joint. This joint is known as the manubro-sternal joint, that is further known as sternal angle. And the last type of the joint, known as xiphisternal joint, the joint between the xiphoid process of the sternum and body of the sternum. It is a type of the primary cartilaginous joint. Now, any question related to the thoracic cage, the bones of the thoracic cage, apertures of the thoracic